One area where the interprofessional team functioned poorly was the transfer of consumer information. David expressed his frustration around having to continuously repeat his whole history each time he saw a new healthcare professional. David reported that when seeing the psychologist for the first time, no information about his situation had been handed over in the GP's referral. David found having to repeat his whole story to the psychologist very difficult and distressing. David wished there was some basic history of his shared with the psychologist to ease the transition to a new healthcare professional.
To address this issue for David, we suggested that the social worker create a biopsychosocial of David's background, but also the factors affecting his life currently, such as social factors, employment, health condition, living arrangement, and his mental health condition. This would prevent David having to retell his story to every new healthcare professional, and those working on his treatment team would have a holistic understanding of where he is at. It would also be about ensuring David has informed consent about who has access to this confidential information and how it is safely stored.
The second issue and barrier which David had to overcome was the lack of continuity of care and communication between professionals. David has been getting instructions from one health professional and another telling him to do the opposite, which has been making it challenging for him, leaving him confused and in two minds. His dietitian approved and insisted that he eats frozen meals, whereas the general practitioner made it clear that he wasn't to eat frozen meals. David reported that the GP instructed him to take medication 1 hour before meals, whereas the pharmacist said to take it with food.
So how to address that would be coordinating care more effectively between healthcare professionals, such as consultations from the healthcare practitioners, such as phone calls and emails between the GP and the dietitian. Clarify of roles, workers understanding the scope of practice and respecting others' professions in retrospect to their own specialized field, making sure that there are a clear set of instructions.
The third issue identified in David's case is poor appointment scheduling. David was frustrated with how there was some miscommunication between the social worker and the occupational therapist, ultimately causing problems with his appointment. Without good communication skills and management, David did not know that an appointment was cancelled and he was waiting while no one came to see him after all. There was also great inconvenience resulting from healthcare professionals in the team located in different areas and have appointments made for him at different days and time. Without planning for his treatment schedule within the team, it took a lot more effort for David to visit them.
In the future, the health professional team should complete regular check-ins with each other and with David to ensure that everyone is clear of his schedule and are informed of any changes there are to his appointments. To assist with this, the healthcare team could create a Google Calendar where each person could access and see when David's appointments are and with what health professional they are with. This way, they can make sure appointments are evenly spaced out so David has enough time to travel to each clinic and doesn't feel overwhelmed by the amount of appointments he has within a week.